Okay, I'm going to run through the IV start skill. So I have my patient, I put a chucks underneath or a towel in case there is blood that drips. I have my supplies, my extension, my angiocath, my flush syringe, my ChloraPrep sponge, a new dressing, a tourniquet, tape, and clean gloves. So I'm going to find a site to use. Put tourniquet on. And look, and I plan to stick along here, and it looks like a good vein. So I will let go of this while I set up my supplies. I'm going to get my extension set, and I like to make sure my cap is on, and I like to loosen or remove that cap and flush it. Make sure I bumped out the air from my syringe. Attach it to my cap. And
What'd you do there?
I flushed that through there to prime my extension, and I put it back in the package to keep it safe. Have my angiocath out. My dressing, I'm going to just open it so it's ready for me when I need it. My ChloraPrep, and then I'm going to use tape to secure my IV as well. So I'm going to tape or get that prepared and put it on the edge of my table. So I have it. Alright, now that I have everything prepared, I'm going to put my gloves on and get ready to start this IV on my patient. So I'm wearing clean gloves. This is not a sterile procedure, but we're going to make sure that all of our items stay sterile.
And you already washed your hands.
And I've washed my hands prior to setting up my supplies. So I'm going to reattach the tourniquet and check where I plan to stick. I'm going to stick right about there. Get my ChloraPrep. Break the capsule. My sponge gets wet, and I'm going to clean the area I plan to stick in a large area around it for 30 seconds. Say 30 seconds has lapsed. I'm going to get my angiocath out. Take off the cover. Hold it by the ridges, and I like to stabilize my patient's arm in their vein. Bevel up, shallow angle, 5 to 15, right above the vein, and stick. And then I let go of my patient's arm. Keep this hand frozen so I don't advance the needle, and guide the angiocath off of the needle into the vein. Light pressure to stop the flow of blood. Remove my needle. I'd hit my white cap in practice. Get my extension. Apply it, secure it, remove tourniquet, check for flashback of blood, and flush 2 to 3 milliliters to make sure I have a patent IV. Remove my syringe, lock my lock, and now secure my IV. One piece of tape, sticky side up over the wings. With gloves on and tape, sometimes it's a little tricky. Chevron it over those wings. My second piece of tape, I'm going to secure the hub. Apply my Tegaderm, centering insertion site, I fill out my label with date, time, and my initials of when I inserted this IV, and attach it to my Tegaderm. And then my third piece of tape, I'm going to secure the extension to their arm just so it doesn't flop around. And we have established an IV.